I wrote this essay in response to the COVID pandemic and my experience with that, in particular being called a hero as a frontline healthcare worker. At the same time that I was going to work and not feeling very heroic, I was thinking a lot about my grandfather, in part because when I was dressed up fully in my protective equipment, I would catch glimpses of myself and see my reflection and see how much I looked like a miner, which is what my grandfather was. When the dread starts to set in, when it gets hard to breathe, I adjust my N95 mask and remind myself of this. I am the granddaughter of a man who worked the depths of Idaho mines and knew a thing or two about PPE hell. My grandfather's name is Don Adams. He was a gold and silver miner mainly in northern Idaho. He has sort of a legendary standing in our family because of the work that he did in the mines, but also to work for miners' rights, working for miners' protections. They really did have to fight for the ability to wear protective equipment, which is kind of funny that this is happening still in our society with shortages that we're having now in the COVID pandemic. Every piece of protective equipment my grandfather wore in the fiery bowels of the earth was a hard-won victory. He and his fellow miners had to fight tooth and nail to wear safety gloves, for example, because mine owners thought the time it took workers to remove and replace them slowed them down sufficiently that it cut too far into their profit margin. Lost fingers were just collateral damage in the wake of unmitigated greed. COVID was like this specter that was just haunting everything. It covered everything. It became like this COVID-colored hospital. And I found it challenging to take care of people when there was so much fear in the air. Can I do this today? Can I be the doctor that my patients need me to be with this new virus? I just assumed that I would get sick, and I made preparations for that. I got my will ready. I prepackaged a lot of meals for my family, anticipating that I would be in the hospital or could get sick and die, and I wanted them to be taken care of. Driving past signs that said, "Heroes work here," hearing grateful praise from my neighbors and other people about being a hero, and I appreciated it, and I loved it, and I took it in, and there was never a part of me that rejected it. There was a part of me that thought I didn't deserve it. And so I was thinking a lot about my grandfather, more and more and more every day. And I remember thinking that, would he think that this is heroism? Because I felt so drained, I felt so depleted, I felt so small, I felt so fearful, and I felt like I wasn't deserving of these titles. And here is a man, my grandfather, who absolutely was. Hero? I wonder what my grandfather would think of me claiming this title. Would he find it as ill-fitting as the extra-large surgical gown and comically oversized face shield I now wear while intubating patients in respiratory distress? Worse, would it be a slap in the face of the real heroes like him, the war veterans, and those architects of our nation who very intentionally risked their lives in the service of that vision? I watched a film called Chosen, and I watched this very much on purpose because I was looking for stories that showed strength and heroism and how people have gotten through difficult times. And there's a scene in this movie where he is standing in front of a mirror, and he's actually dressing up as an SS officer to help aid the resistance movement, and it's something that he's very reluctant to do. And you see him putting on the hat in this film. He's just really struggling with doing this that he has to do, and he starts screaming in the mirror. And I'm watching this, and I am just relating so hard to this, feeling like this is what I have been doing for the past several months. Every time I'm putting my scrub cap on in the mirror, every single moment of that, I am screaming in my head about not wanting to do the things that I have to do, not feeling like I can do the things I have to do, feeling rage about it, feeling anger about it, feeling sadness about it, feeling tired about it, feeling like this is not what I want, but feeling also like I have to. This is what I have to do. And he got this rage out, he got this fear out, and that's what I was doing as I was screaming internally doing these things in the mirror. When I am fully gowned up, I look startlingly unlike myself, unlike any human really, to the point that I've had patients fearfully recoil during examinations. I found it helpful to carry a picture of myself to show to patients so they know who is caring for them. We both smile beneath our masks once we've been properly introduced, and I can continue my evaluation as they visibly relax. It feels like a remnant of life before the pandemic, an intentional reminder of the why behind the how we will get through this. A bit of light protest even. The next morning I woke up and I felt just a little bit more able to go about my day, saying it's okay to be scared, it's okay to be angry, it's okay to be full of rage, it's okay to feel all of these things. I can still do my job. I can still go and do these things and admit that I'm small and tired and angry, and it's fine. And maybe my grandfather felt small and angry, and that's maybe what propelled him to go and do the things that he did. At the end of my shift, I slowly remove my mask, taking care not to contaminate myself. As I stand at the sink in front of the mirror, scrubbing my hands and humming a familiar melody to keep time, I study the deep indentations across my nose, my grandfather's nose, left by the mask. Is this the face of a hero, I ask? I have to be a fighter for this. I don't necessarily want to be, and I think part of the role means that I am a fighter. I look at this as an opportunity to rise to the challenge of what my patients need from me. And for me, that's where my strength comes from, is in being able to still connect with my patients, to still be a human to them, to still be able to comfort them. That is when I get strength. To me, that's not bravado. That's the best of being a physician. That is why I went into medicine. And so when I found a way to still do that, that was my strength. That was me being, to me, a hero. Is this the face of a hero, I ask? The question makes me uncomfortable, and today I do not have an answer. I take a deep, unimpeded breath for the first time that day. My lungs clear, my heart steady.